Hello and welcome. I am Savita Moses and I'm here with Dr. Vincia Pandian to discuss lung health and how to prevent lung cancer. Dr. Vincia, are you able to introduce yourself?
Yes, thank you, Savita. So I am Dr. Vincia Pandian, and I'm an associate professor and assistant dean of immersive learning and digital innovation at the Johns Hopkins School of Nursing. I'm also an acute care nurse practitioner, and my clinical expertise is in caring for respiratory problems. And my area of research really focuses on improving the quality of life of patients who are mechanically ventilated, meaning patients who are on artificial breathing machine.
Awesome, thank you. So excited to be able to be here with you. Can you provide an overview of the importance of lung health?
Sure. Lung health is really crucial for all ages, and it's a gift from God for us to have the benefit of living with healthy lungs. Lungs helps us to breathe in oxygen and get rid of waste gases from our body. Lungs are the organs in our body that really helps us to have an overall sense of well-being, have great energy, and be able to participate in daily activities. Lung health is also crucial because if our lungs are not healthy, then we're prone for many respiratory diseases like upper respiratory infections, such as influenza or flu, bronchitis, pneumonia, and even lung cancer.
What are some common factors or lifestyle behaviors that can contribute to poor lung health or increase the risk of lung cancer?
Yes, the most common risk factor for diseases related to lungs is smoking. And for those who don't smoke, secondhand smoking seems to be the topmost cause for it. But there can be pollutants in our environment that can also contribute to issues with our lung health. Some of the things are those that we're exposed to at work, which are called occupational hazards. There are also dust particles and mold and different harmful agents in our environment, in our homes also. So how we cook, sometimes even grilling out in the backyard seems to be fun, but you could get exposed to smoke. Or if you're cleaning your house with certain sprays, that could also put out toxic fumes that can be injurious to your lungs.
Can you explain the relationship between smoking and tobacco use and lung cancer? And how can we educate others, especially children, about the dangers of smoking?
Yes, so smoking is actually one form of tobacco use because of the contents that's in it. Smoking has cigarettes and various smoking contraptions have a lot of nicotine and carcinogens in them that actually can get into your lungs, into the airways, and damage the airways, and that can lead to breathing difficulties, and also in the long run can put you at risk for developing lung cancer. In terms of educating children and even adults in our community, I think over the years, all of us have really appreciated the ill effects of smoking, and so not many people do it like they used to in the past. But the new thing that our children are getting exposed to is vaping. It seems like fun. It seems like it's not, it appears that as though it doesn't put out the same level of smoke as the regular cigarettes, but it does have the same level or even higher levels of nicotine in them, carcinogens. They add some additives and flavors which can actually be harmful for our airways or our lungs overall. Some of these vaping devices, they use liquid. It's called the vaping juice that actually can deposit in the walls of the airways, can really damage the lungs. One of the most common problems that we are currently experiencing with vaping is something called as popcorn lungs, or it's also called as bronchiolitis obliterans. It basically damages the smaller airways within our lungs, and that can really cause breathing difficulty. And people who really are having damaged lungs can get very sick to the point they may need to be put on even breathing machine. So it's so important to think about the harmful effects of vaping at a younger age, when it seems like fun and you're trying to be part of your peer group and trying to connect with them. It's important to think about the long-term effects, because honestly a lot of people don't know what the long-term effects are, because it's been introduced into the community just over the recent years. But we do know that the level of nicotine and the carcinogens and the various chemicals in them are much higher than in cigarettes.
That is so interesting. Thank you for sharing that. I don't think many people realize that, so very much appreciated. Are there any specific dietary recommendations or foods that can help prevent lung cancer?
I'm not sure if there's anything to prevent lung cancer, but there are different types of foods that we can consider to improve the lung health itself. I think first and foremost is to have a well-balanced diet with appropriate amounts of fruits and vegetables and carbs, and lean protein really help us to strengthen our lung muscles. In addition, we should also consider antioxidants like berries and nuts. They can also contribute to the health of our lungs itself. The other thing we should be thinking about is omega-3 fatty acids, which have been found to be helpful. You find these in fish products, especially salmon. That's something that you can consider. But the most important thing that you want to think about is hydration. Hydration is so important to really cleanse out all the waste products from our body and help our cells to rejuvenate. And so I always walk around with bottles of water, because that's so important, not just for your lungs, but for your overall health of your body, for your skin, and just to feel refreshed and feel good and have the energy as well.
I'm so glad you said that about the water, because it's one of those things where you know it's important and you should do it, but it's just something people don't always prioritize in their day. I myself am trying to get better about drinking more water every day, so again, thank you for mentioning that. For those living in urban areas with high air pollution, what practical steps can those individuals take to protect their lung health and minimize the risk of developing respiratory issues?
Yes, so many times we think about only those risk factors as it pertains to what we do in our lifestyles, but sometimes the things in our environment are also, they can also cause lung problems. So if we are living in an urban area like most of us do, one of the things that we should be thinking about is frequently checking and monitoring the air quality levels and the pollution levels. And the way we can do is by looking at our phone, our mobile apps, and also like going on the web and checking out. Sometimes many of you tend to watch news in the morning, and they do share the air quality information as well as part of the weather portion of news. So it's really good to keep track of what the air pollution levels are like outside before you go out for your work, for your school, whatever the case might be. Once you figure out what the pollution level is, if you know that it's really high, you may want to try and minimize activities outside so that the time of exposure to these pollutants is decreased. Also, when you are indoors as well, you need to be very careful about being in closed doors at all times and not allowing enough fresh air. So having good ventilation is also important. So you need to follow the manufacturer's instructions in terms of how frequently you need to change the HEPA filter, check out your heating, ventilation, air conditioning system to make sure that there are no dust and particles built up that can put you at risk for those breathing difficulties as a result of being exposed to such irritants in your airways. As I mentioned earlier, you should also be cautious when you're cooking, when you're using sprays at home, and also when you're getting exposed to animals at home as well. I think all of us love to have pets, and we need to really clean the environment to make sure that you're not exposed to dander and hair and so on. So having a clean environment is important, and also when you're going outside, it's important to monitor the environment and plan accordingly. If you do think that the pollutant level is really high outside, one of the recommendations is to actually wear N95 masks. I know all of you are familiar wearing that, especially since we experienced wearing them during the COVID-19 pandemic. So it's not just when there is a pandemic, but even when you're going out to lawn mow and you think that you're going to be exposed to dust particles or grass clippings, it's best to wear these masks and protect your lungs.
Those are such great everyday tidbits that we can apply around our home and in our lives. So great information. Moving on to the next question. How does regular physical activity impact our lung health? And are there specific exercises or activities that can help keep our lungs healthy and strong?
Yes, regular physical activity is so important, not just for lung health, but just for our overall health as well. But specific to lung health, some of the exercises that I would recommend are cardiovascular exercises that actually help you to work to a level that actually increases your heart rate, which in turn actually helps your lungs as well. The other type of exercise that we often recommend is aerobic exercises like jumping jacks or skipping, just simple exercises, but it actually improves your lung capacity and improves the lung function as well. The other type of exercise that we encourage is interval exercises, which is high intensity interval exercises. So this is where you work in bursts where you're actually pushing your heart rate to go up, and then when you get to a certain stage, you pause and allow continue to do exercise, but at a lower intensity. So you can catch your breath, allow yourself to calm down, and then do another burst of exercise. And this is helpful so that you don't get exhausted, don't get tired, but at the same time, you can actually continuously do it for longer periods of time by alternating between high intensity and low intensity exercises. The other thing I would also recommend is deep breathing exercises, and this is something you don't have to allocate any particular time to do the workout. Even in your daily activities, when you are sitting at your office desk or in your classroom, or even when you're driving or sitting in the back of the car, just take a moment to do deep breathing exercises, because that actually allows you to expand your lungs, inhale more oxygen, and get rid of all the waste materials, the carbon dioxide. Another exercise that can also help you is swimming. Because when you go underwater, you actually hold your breath, which actually strengthens your lung muscles as well. The other thing I would also suggest is anytime you do exercises, plan to do some warm-up and then also do some cool down as well, which is very, very important. Otherwise, sometimes we jump right into doing the workout, which actually puts kind of stress on your body, and then you jump right out of it, and then your body hasn't had the time to recover. So think about your pre-workout warm-up and post-workout cool down.
Wow, there definitely is a variety of things that folks can do to help improve their lung health, just depending on their interests. So that's great, lots of options there. Are there any early warning signs or symptoms of lung problems that individuals should be aware of, and at what point should they seek medical help?
The early warning signs of poor lung health or warning signs for some kind of lung problem, one of them is persistent coughing. We may think that that's normal and ignore it, but that could be a clue that something is not right. Severe shortness of breath. Like when we work out, we do develop some shortness of breath, but when it gets extreme, even when you're not doing any activity, that is a sign that we need to pay attention to. Wheezing is a red flag. You should definitely reach out for help. Also, if you're coughing up blood, that's something that we may not be thinking about, and that might be an early warning sign indicating that you may have lung cancer. And also, if you are developing frequent respiratory infections, that might be another thing that's also indicating that your immune function is not strong enough, and maybe your lungs are not strong enough. So you may need to do some lung exercises to improve that. So you may need to reach out for help. The other thing is if you're feeling tired, fatigued all the time, or if there's any changes in your skin color. So if someone is starting to look bluish gray, or even if the nail beds are not pink as they should be and they're turning gray, that could be another early warning sign. And with the changes in color on the nail bed, it can be related to lungs, it could be related to heart as well. So when do we really seek help? That's when you have extreme shortness of breath and it's just not getting better, or if you start breathing very fast and you're not able to slow down. So rapid breathing, if you develop chest pain along with it, or if you feel like you don't know where you are or things don't seem right, like you start feeling confused, that might be another sign. Also, if you feel like fainting with your shortness of breath and chest pain and you feel like you're going to faint, you should definitely reach out for help.
Thank you for that. Breathing is just one of those things that, we do consistently, so it's something many people take for granted. So definitely good points of seeking help, if we suspect any of those things.
You're right. We definitely breathe without even knowing that we're breathing, but the moment you start paying attention to it is a clue that something's not right as well. It may be related to some of the activity that you did, or maybe related to some level of anxiety or some kind of stress that's going on around you, and then you know that that's what's causing it. But if you are noticing that your breathing is heavy or fast and there's nothing is causing it, then you may want to definitely seek medical help or take a moment to think about what's changed in your life.
Can you please discuss the importance of regular checkups and getting lung screenings?
Yes. So when we go to a healthcare provider and get regular checkups, they can actually look for some of these risk factors and early warning signs and try to help us to prevent from lung diseases and lung problems. One of the things that we need to be careful about is if we have a family history of lung cancer, especially if it's with the first degree relative. What that means is if it's your parents, your siblings, or your children. If any of them have lung cancer, then you need to get yourself checked up as well. Often we tend to seek help from our social group, our family members and community if we do get diagnosed with lung cancer, but there are also times when individuals don't want to share with their parents to avoid burdening them, or they don't want to share with their children to avoid them getting worried about you. But with lung cancer, it's better to be open and share that with them so they can take care of their health as well. The United States Preventative Services Task Force, or USPSTF, they actually have recommendations for those who are at risk for lung cancer, especially if you have a family member who has it. They recommend getting low-dose CAT scan of your chest if you are between the ages of 50 and 80, or if you have a 20-pack you're smoking, which means you smoked 1 pack per day for the last 20 years, or for about 20 years. And also, if you are a current smoker or quit smoking within the last 15 years. So those are the national guidelines here in the United States. So if you are at risk as a result of someone in a family member, or the age factor, or you being a current smoker, you do want to reach out and get those screening low-dose CAT scans done.
We often slack on our doctor's appointments and checkups, so if you're watching this is your sign to make an appointment and get screened. All right, so moving to our final question, what message would you like to convey to our community about lung health?
Yes, so lung health is a precious asset that forms the foundation of who we are, and that helps us to live a vibrant and active life. Our lungs really empowers us to have a life that is worry-free, because if think about having to think about every breath you have to take. So being able to breathe easily and not even think about it is so important. And so lung health is very precious for all of us. In order to have a good lung health, we need to educate ourselves on the importance of maintaining it, and also maintaining a tobacco-free environment. We also want to advocate for clean air, because all of us need to take care of our environment, and not just about what's happening currently, but also the future of this earth. So we are leaving a cleaner environment, healthy environment for our future as well. We definitely want to nurture an active lifestyle where we are not sedentary, and we are exercising regularly and being in a fit shape so that we can really live our life to the fullest. We also want to make good dietary choices in terms of eating a well-balanced diet, maintaining safe indoor environments, like I was talking about, checking our heating, our ventilator, air conditioning system. In addition to that, one of the things that I had forgotten to mention is about checking the carbon monoxide levels inside our homes. So make sure you have detectors at home and you're changing them at regular intervals as well. Seek regular checkups and make sure that you're keeping up with your appointments with your physician or whichever healthcare provider that you go to. Also, make sure that you are being role models for each other also, because the way you carry yourselves serves as you serve as a model for those around you. It may be your parents, it may be your siblings, it may be your children or extended family, or even your friends and colleagues at work. They're watching you. So we as Christians have a responsibility to serve as a role model for others. Remember that your future is worth the effort, because every small step that you take now is going to help you to have a healthy future. So take care of yourself and breathe easy.
Such good information. Thank you so much for sharing all of that very helpful information with us. I feel better informed. Hopefully those watching this feel better informed and better able to take care of their lung health. But again, thank you so much, Dr. Vincia, for talking us through how to keep our lungs healthy and strong. We
You're
appreciate
welcome.
it.
Thank you.